We're here today with Era. Era.
Era.
Era is a show greyhound. And Era came to us.
She's demoing it very nicely.
Yeah,
Good girl.
She, a week ago, three-legged lame.
Not even a week ago, 5 days ago.
Yeah.
And she could not put weight on this right hind. She was carrying it and bunny hopping, and not even bunny hopping. She was hopping.
And our goal with Era, because the show dog has this short show period, we had a cruciate problem.
We had a potential cruciate problem, yes.
Or a tear. That was the diagnosis, was a cruciate problem.
And surgery would have put her out of work for a good somewhere between 6 weeks and 6 months.
Depending on how fast her rehabilitation went. So we decided with the owner to try some alternative therapies. Era has got, you notice all her electrodes or her little pads set up, and she's wearing this nice little machine on her collar here.
And she's also been using the larger version of that same machine
we're using,
in other areas.
We're using a machine called an alpha stem. Now an alpha stem is 1/10,000th of a TENS unit. And a lot of people are familiar with the TENS unit. But the alpha stem is 1/10,000th of that amount of current.
So very, very low. It's called microcurrent.
Microcurrent. And what that little current does is it actually increases. We can't see it's hooked on now, and if you zoom in here, you don't see any muscle twitch going on like we would if we had a TENS unit on there, because a TENS unit fatigues the tissue, and when the tissue gets tired enough, it no longer hurts. But with the alpha stem unit, we're actually going in at that cellular level. We're increasing the amount of cellular ATP, which is what the cells require to heal.
So with this microcurrent, we can get those cells to excrete their waste products in an efficient manner while the cells are actually building up and becoming stronger.
There's different ways we can use the electrodes on the alpha stem. We can hook them up here. We want to make sure we have an X going through the area of tenderness, which she had an area of tenderness in her middle of her back, and then also on her knee. We can use the wands and make X's
to stimulate different areas.
And we can also use the ear electrodes, which we would clip on her ears. And
for those dogs that are anxious in their kennels or that are having trouble settling down, the ear electrodes are very helpful because they actually send a microcurrent through the vestibular system to the brain.
And help these animals calm down. So this is one way that we can use. But one of the things that we look at when we're evaluating a form of alternative therapy, a form of rehabilitation for these animals, is we want to know the science behind these things.
And we want to make sure that it's going to actually deal with not just warm an area or cool a muscle, but we want to see how is it going to affect the rest of the system. How's it going to affect the brain? How's it going to affect the motor cortex? How is it going to affect, the rest of that whole system? Is it going to increase waste products in the area so that we're going to have a hard time getting rid of inflammation, or is it going to allow those to heal? What's it going to do to the liver?
And let's take a look at the video. And the video we have from our camera home is a really great video.
Hey, it's good enough video. It shows, you can see how lame Era was. She was acute. She had a lot of pain. She was carrying the leg. She was not putting weight on the leg. She didn't want to use it. And when we look at even things like a potential cruciate tear, we use our knowledge of neurology and anatomy to go back and treat the area that caused it. That's why she's got pads on her back, Dr. O, is that if we tear a cruciate, we know that it's because we have muscle weakness around that knee. If we have muscle weakness around that knee, I know that she's got nerve weakness in signal coming from the spinal cord. So I'm going to go back and treat the spinal cord. Well, if the spinal cord has weakness in its signal, the muscles that surround that spinal cord and allow it to move also have muscle weakness. So we go back to the cause.
Right.
Not just to treat that one little area that was causing her trouble, the knee, but I want to go back and treat the level of inflammation that's really the cause of the problem. And we can see that that's been really successful in this dog.
Yep.
She's now actually trying to get away from us, whereas 2 days ago she would have laid here all day long.
Right.
Because it hurt to get up. So thank you for coming, Era.
Thanks for coming, Erin. Until next time.